I think human life, regardless of where you live on this planet, is all about freedom. And mobility is freedom. Okay, so how do you achieve mobility? Well, one of the ways you do it is to find out what you can or you can't do. I see my doctor about twice a year, and when I go into the office, he has to page through a 3-ring binder in order to find out how I've been. But this is only twice a year. I'd like to know what's going on the rest of the year.
Well, Philips is highly motivated to help people with chronic conditions. Cancer, heart disease, diabetes, but also COPD. And we decided to focus on COPD first with our eCare platform, in which is really engaging the patient and then collaborate the care behind that patient. And that's what we're doing here at Radboud Hospital.
You know, we're great at delivering healthcare in our own hospital. But bringing it outside of it, into the homes of people, that's a different topic.
You know, I've had 3 open heart surgeries, 2 hip replacements, COPD, you name it. I would love to see how my heart and lungs are working on a day-to-day basis.
You know, there's what I consider to be a fundamental mistake in how we manage information in healthcare. And we haven't had any choice in the past, really, because the technology hasn't been there to solve this problem. What we do is we discover a problem after it's become a problem.
For chronic illnesses like COPD, every office visit or test is just a snapshot in time of the patient's condition. We use these snapshots to determine our best recommendation for treatment, but it's always an incomplete story.
The eCare application, combined with our Here's My Data platform, will create an environment for patients to really be empowered. With new wearable technologies, we can use sensor to track the patient's health measurements. The data is captured and collected in a cloud-based application. Both the patient and the provider can see what's happening in real time. So providers can adjust treatments between visits, and patients can monitor their own condition.
You know, for generations, how we practice healthcare has not changed. And now, in this continuous and connected world, we're going to be able to change everything. Philips bringing eCare Coordinator, Radboud bringing this wearable technology and new ways of delivering care, and Salesforce enabling it through our cloud technology.
For the first time ever, we really are creating an environment where patients can really act as partners within their own healthcare. And that's awesome.
But just consider, all right, just the ability to capture the information in real time. Information is value. Who has more at stake in the accuracy, completeness, and availability of good quality information than the patient and family?
We're at the beginning of a transformation in healthcare. The next 50 years of healthcare will blow away everything that we've done in the past.
Well, what you have seen is what we can do for COPD patients, how we can make their lives much better. And it's only the beginning. It's only the beginning of what we can do for patients with chronic conditions and what we can mean for healthcare.